Hi everyone, Chelsea Kirstens here, the Executive Director of Epilepsy Durham Region. I'm here alongside Melike Ceylan-Leamen, Epilepsy Durham Region Board of Directors volunteer, epilepsy advocate, caregiver, all the things. And we're here to talk to you today about Purple Day for Epilepsy Awareness. March 26th is Purple Day. It is an international epilepsy awareness initiative which was created by 9-year-old Cassidy Megan, local to Nova Scotia, Canada. In June 2012, the Canadian government passed the Purple Day Act, which declared March 26th Purple Day the official Epilepsy Awareness Day across Canada. It is a time for communities to unite to support those affected by epilepsy. It is a time for people who are living with epilepsy to feel less alone, and it is a time for community epilepsy agencies like Epilepsy Durham Region to raise awareness and provide public education about epilepsy, its challenges, and the impact on daily life for those impacted by epilepsy. So Melike, I was wondering if you could share a little bit about what initiatives like Purple Day mean to you and your family.
It gives us an opportunity to build awareness around epilepsy. We as a family have been struggling with epilepsy, so our journey with it has been for over a decade now, probably 14 years, closer to 14 years. So Purple Day gives us the opportunity to visually celebrate all the things that different agencies do, as well as kind of research to help those families and individuals with epilepsy. So being able to wear purple, being able to go on social media, talk about epilepsy awareness, it's super important for, I think, everyone, politicians as well as community leaders, to really recognize that this day and those people struggling with epilepsy is actually quite important.
Absolutely. I think that there's a ton of misconceptions around epilepsy, and it's still very wildly misunderstood condition. And so a day like today gives us a chance to really shed a light on that and provide some education and hopefully create some normalcy around the word epilepsy in our community.
Absolutely.
Mm-hmm. And I think what I'd like to do is kind of like paint a bit of a picture for those who are going to listen in on our video. I always like to say, imagine a world where you wake up every morning with the uncertainty and the fear for your safety and well-being. This is something that your family knows all too well. And this is the reality for all families that are impacted by epilepsy. I always say it's a chronic condition that has the constant companion of unpredictability, just a permanent fear of the next seizure. And we know very well that the challenges associated with epilepsy go well beyond just the physical side and the seizures themselves.
Okay.
It is a chronic neurological condition, so 1 in 100 people are living with epilepsy. And while the physical detriments can absolutely be catastrophic for some, I would say that they're equally matched by the psychosocial effects of living with epilepsy. We know in our community that we have an increased incident rate of depression and anxiety, suicide ideation, and completed suicide, in contrast to the general population. We know that our clients are expressing isolation concerns around stigmatization. And these are pieces that we are facing as an organization regularly, and I'm sure that's something that probably resonates with you and your family.
Absolutely. It's been the medical piece of it is one concern. There's a lot of unknowns around my son Aiden and his seizures. We still don't have a reason why or how it started or what actually triggers most of his seizures. The social piece of it is he has difficulty making friends. He has difficulty in social situations with overstimulation. He has comorbidity with ADHD, so he's on medications for that. He has learning disabilities due to all the seizures he's had in the past. So all of those compounded really affect him. So he surprisingly, he seems to be, because he's had it for so long, he seems to, that's part of who he is now. So I think it's a lot more difficult for for those who get epilepsy later in life, because it's a bit more difficult. For Aiden, he's had it, that's all he knows. But there are a lot of situations where he does struggle in trying to, again, to build friendships and sustain friendships and again with his seizures, he doesn't get to do the fun stuff like go to overnight camps because the seizures happen at night. He can't stay over at a friend's house. He has to be monitored every night while he sleeps. So there's these things that other kids don't have to go through, and it's hard for other kids his age, he's 16 now, to understand what his struggles are and why he can't do certain things.
And I would say that that is sort of the reality for a lot of people living with epilepsy, where they feel very alone in their circumstances. They often don't share a lot about their condition. I have clients who are connecting with me regularly, and we have a lot of conversations around grief. So when you bring up someone who develops epilepsy later on in life, it's oftentimes the grief around the loss of who they were prior to the seizure. And on the flip side, when I have parents who are connecting with me with young children who are living with epilepsy, there's a different type of grief. It's a grief for the future that they wanted for their child, and what is that going to look like? And epilepsy knows sort of no boundaries. It impacts young people, older people, men, women, people of all different races. And but we do see through-throughs with all of these people that are reaching out to us. They are all seeking connection. They are all seeking mental health supports in some capacity. And we know that a critical piece of the puzzle to living well with epilepsy is connecting to supports like community epilepsy agencies, like Epilepsy Durham region, so that they're able to surround themselves with a community that understands the nuances of the daily impacts of epilepsy. I think that's the challenging piece to convey, is just how much epilepsy impacts day-to-day living. So I wonder if you could shed some light on that for you and your family.
Yeah, I mean, we've been working with Epilepsy Durham region since 2014, 2015. Early on in Aiden's journey, understanding medically why his seizures were occurring. And questions that I would have, because again, when that happens, when a child gets diagnosed with epilepsy, and then he was also, I was told as a mom at the Children's Hospital that he's at risk for SUDEP, which is sudden unexplained death from epilepsy, because he stops breathing for extended periods of time at night. So as a parent, like, where do you turn to get answers like that? So I would reach out to Epilepsy Durham region, get on a call and say, oh my God, I'm freaking out. I don't understand this. Can you help me understand what is SUDEP? What can we do? Doctors are telling me one thing. Can you connect me maybe to someone who's kind of experiencing the same thing, so we can see what kind of, if there's a coping strategy that we can put in place. And then secondly, when Aiden was up for vagus nerve stimulator, first thing I did was call Chelsea and go, what is this? And she actually made a connection to the company, so that I was able to alleviate a lot of the fears I had around VNS by talking directly to the company, and then talking to Chelsea and Epilepsy Durham region about other patients community members who also had a VNS. And then just ongoing. So anything I have, we've been part of this journey for a long time, but there's always something new that comes up. So like the stereo EEG, what the heck is that? Contact Epilepsy Durham region. They could figure that piece out with me. And it's not just to give me all the answers, it's to listen to me, because there's not a lot of folks I can talk to that understand this. And when I'm in that manic state of trying to understand what's going on, they're very patient with me. Whereas if I, want to go to a family member, they also get very excited, sad and upset and confused. So it doesn't quite help me. But Epilepsy Durham region has always been there to kind of support everything we do.
And that's a big piece of what we do in terms of services that we provide. We have very comprehensive epilepsy education services for those who are newly diagnosed, to ensure that we're helping families early on in that diagnosis try to avoid any crisis situations, but also provide the self-management techniques to hopefully live well with epilepsy at home. But in addition to that, we are really working to create a community. So we do have mental health supports in place in terms of peer support avenues. We have adult and caregiver support programs, and we really have become a very tight-knit group in both of those groups, in both of those settings. And we have also had the luxury of being able to provide Uplift in the past, which is a comprehensive mental health program specifically designed for adults and caregivers of those affected by epilepsy. We are looking to relaunch Project Uplift this year as well, and also looking to adapt Project Uplift specifically for youth, which is something that I would say is, those sort of supports are kind of lacking everywhere right now, is those really specific mental health supports for youth living with epilepsy. And it is a different need than mental health supports without the chronic condition.
That's absolutely true, because we've been working with sick kids, psychiatry, social work, we were on the waiting list for Grandview Kids. I had personal insurance through work where we would talk to a psychologist. Problem is with Aiden, because it's such a complex situation. He doesn't have like basic anxiety or basic depression or ADHD. It's all of these factors that contribute to some issues that he has around, okay, is it drug interactions, right? He's taking 4 different drugs. Is it drugs? Is it the lack of sleep at night because of the seizures? Is it because of overstimulation? So all these factors, it's very hard to find someone who can help Aiden understand why he feels the way he does, why maybe he overreacts to something or gets angry, and then how we, what coping mechanisms can we help him with, so that when he does get that way, how he can help regulate his own behavior, his own thoughts, his own feelings, to be able, again, to help in social situations. Because right now there is a big gap. We haven't found that support yet.
And I think too, there's so much to be said for being a part of a group where all of the other individuals are sharing the same complex condition, because there's just a really intense feeling of belonging for people who in our population typically feel like they don't belong in many social settings. So it is absolutely a huge goal for Epilepsy Durham Region to incorporate some very strong mental health programming for our youth and continue to build on our mental health programming for our adults and our caregivers. I'm wondering if you could share ways in which you could feel more supported by our community.
I mean, up until now, it's been fantastic. The supports I've gotten from Epilepsy Durham Region and the agencies. What I would like to see more again is the mental supports for youth, because that is a big gap that we see, and creating those peer support groups for youth is important, because it's one thing for a young person to talk to an adult. They have different needs, different feelings. Then I can only help Aiden to a certain point. But yes, to talk to someone his age and then have someone who's professional who understands is super important. So that to me is really important. Is that piece seems to be missing. The hospital is great when it helps trying to control even seizures, but as the doctor said, we don't really care about his behavior or all the stuff that's going on. We only want to try to control his seizure. So there's that gap, and they leave that to the parents and hopefully the community agencies can help support.
And that's most of the individuals who connect with us. They're typically happy with their medical care. If not, we are helping them to understand system navigation, so understanding what their potential treatment pathways are. Like you said, when you sort of started to venture down the VNS route, helping individuals to understand what that looks like, and then for those individuals who are not connected with the appropriate physicians, really helping them to work to find specialists who can help them to manage their condition. But like you said, that is just one piece of the puzzle. The community side of everything is incredibly important, and that's where our programs really come into play. We have individuals who are connecting with us with a sense of lack of purpose, feeling as though they're desperate to work but unable to work, and how will I ever have independence? How will I ever have a job? Who will ever love me? Which are really they're very intense feelings to go through. And when we're able to connect those individuals with local community services like appropriate psychological services, like Project Uplift, like our support groups, we start to see individuals feel empowered, confident, and capable, and then starting to manage their disease internally. And that is a huge piece to living well with epilepsy. And so really one of the big things as we're celebrating Purple Day this year is that we are launching our Epilepsy Empowerment Circle. So we are looking to our community to help our organization by uniting together and helping to support our mental health programming, especially our youth mental health programming. This looks like trying to have new monthly donors. So we are looking to acquire 10 new monthly donors at $25 a month, less than $1 a day, to support our mental health programming with a goal of raising $3,000 for this week. And I know that would make a significant impact in the lives of families like Melike, in the lives of so many community members who are connecting with me with their stories and challenges and triumphs of living with epilepsy and really working to bring everybody together.